we asked him if his name was Dr. Allen, and it was. So, Dr. Allen, how you doing, man?
I'm good.
Thanks for coming on live.
Hey, absolutely. Thanks for having me. Yeah, it's a pleasure.
So, we were just talking 4 practices, right?
Yes.
4 practices, and we wanted to have you talk a little bit about ADOM, and I think more importantly, you know, your office manager and what ADOM has been for them, and more importantly for you as a practice owner.
Thanks. Yeah, we kind of got involved really basically through my wife.
Yep.
She runs our 4 offices kind of as our business director, and so she got involved with ADOM several years back, and has been kind of active and starting an East Texas chapter, actually. She did. And so trying to just bring education for front office staff.
Yeah.
You know, I feel our staff is my most valuable asset in the practices, and any way that we can kind of pour into them and make them feel valued is a good thing. And I think ADOM does an amazing job for front office staff to make them feel like they're appreciated and they contribute to our success.
Well, and I'd have to imagine from your perspective that the confidence to know that a lot of the business pieces, you know, are being managed, which I mean, I'm sure they already were, you know, but talk a little bit about like maybe the next level, like some of the things that she and the team have learned that have really kind of taken things to the next level.
Yeah, I think one of the benefits of our practices is that I kind of am just clinical, and I kind of rely on Brittany and her staff to run the whole front office. And they've really, through ADOM, I would say, have found great partners that have allowed our practices to continue to move forward. So a lot of what we use, especially when it comes to front office that I don't know a whole lot about, it's all found kind of through their ADOM connections. And it's been valuable for us.
That's awesome. Is this your first ADOM conference?
This is my first ADOM conference. Okay. They've come a couple times.
Sure.
But again, I was just trying to support them. And, and it's been awesome. It's been good.
I love it. Anything in particular when you think about the last almost 2 years now of what we've gone through in dentistry through the pandemic that you know the team was able to put together and kind of lean on? Maybe they drew on the ADOM community or just something to help all of you get through, you know, what's been a time in dentistry that we've never seen before.
Yeah, definitely. I think they mentioned this morning kind of about the podcasts and the online stuff that y'all were doing, because we definitely leaned on. I don't even know everything that they leaned on because. Again, I'm kind of concentrated on taking care of patients, and
they were doing
have patients. They were kind of taking care of everything, and so I know we were shut down for 6 weeks in Texas, and during that time, my staff, Brittany and Hannah and all of our office managers, they were figuring out, okay, how do we manage all this? And I know they leaned on ADOM resources throughout that time for sure.
So what would you say, dentist, practice owner, to other dentists out there? I mean, you obviously talked about the value that it's been.
Yes.
But you know, doctor to doctor, in regards to maybe someone that's on the fence, and just making that decision to support their team, their business manager, to be a part of ADOM.
Yeah, I think it all goes back to that your staff is your most valuable asset, and pouring into them however you can. Not everybody's motivated by giving them a raise or writing them a paycheck. So to me, helping them grow and feel valued and to grow their knowledge base, I think is a huge thing. And so for me, I'm kind of big on continuing education anyways, from a clinical standpoint. Sure. So for me, when I have front office ladies that want to learn more, that want to grow, I mean, I think it's a good idea to support them.
I love it. Well, I'm sure they appreciate you being here. And I know they're going to have fun, as hopefully you will, for the next couple of days. So I really appreciate you coming on and sharing what your experience has been like. And
absolutely.
Hope you enjoy it.
Absolutely. Thanks
for
having me.
All right, you got it. Thanks for coming on.
Appreciate it.